Leveraging pharmacy informatics to keep health system patients in health system pharmacy. Ambulatory Clinic Edition. I am your presenter, Barry McLean, and will be presenting and posting this on pharmacyinformatics.net. This presentation has specific details for pharmacy leaders and informatics teams about prescription capture within the ambulatory clinic space. Focus of this presentation will be on the pharmacy verification queues for prescriptions. Some health systems that are on the Epic EHR or electronic health record call this multi-step order transmittal, which is really just fancy speak for sending orders to a medication order verification queue, or simply saying verifying orders. And before getting too deep into it, I have a couple of disclaimers. Although this is a very powerful tool, it is not a magic bullet. And I will reiterate that point to make it very clear, probably a couple times in this presentation. And also, before tailoring and introducing a new type of technology in your prescribing workflows, just an always best practice to consult your compliance and legal teams and get those necessary approvals. But that's a concept and that I want to dive in for this presentation. So interventions to increase ambulatory prescription capture. And I'll be referencing an article published in 2020 in the American Journal of Health System Pharmacy, a framework to increase prescription capture from health system clinics. I think this article does a good job describing the common interventions that health systems do to promote pharmacy services and increase script capture within the health system. So usually the first intervention that health system pharmacy will do is put a pharmacy in the clinic. And you would think that is good enough to start capturing a lot of prescriptions. But unfortunately, that is usually just the beginning. Unless, for example, you have a pharmacy that is within a large mile radius from another pharmacy. Next on the intervention list is staff education about pharmacy services. So you put one of these pharmacies in our clinic, but what can they do? Why is it better? That is something you have to promote. Another intervention commonly done is creating or revising scripting provided by clinic staff related to pharmacy selection. So instead of saying, what pharmacy would you like us to send your prescriptions to during this encounter? You might create a better hook that's promoting and advertising your pharmacy. Additionally, you have EHR optimization, like completing a referral or another type of communication. And then lastly, just your kind of variety of marketing materials, like having flyers and clinic rooms and around the waiting rooms, messaging on TV monitors and screens throughout the health system and clinics. You might have handouts, posters, those types of things. So challenges. So first of all, this is very dependent on clinic staff promoting pharmacy services. So providers and staff don't always tend to be the greatest salespeople. Now, if you can really build in buy-in with both pharmacy and clinic staff and really fully bake in pharmacy fulfillment within the workflow, I have to say, really good for you. And that is the way I would do this and my number one recommendation. However, my experience suggests that clinic staff just don't do the best job upselling and is pretty difficult to sustain. Then you have the referral orders and or other communication tools built in the EHR. Those are usually asynchronous with prescribing, and clinic staff just have to remember to do that task in addition to prescribing the prescription itself. So it simply isn't going to happen 100% of the time that you're expecting it. Scalability, That's difficult, particularly when you have lots of sites of care, lots of staff, lots of turnover, etc. And then you have the patient perspective. You have loyalty that a patient has to their current pharmacy and pharmacist, which makes sense. But you also have, perceived cost savings and convenience and customer service, etc. Usually it's perceived when no other better options are presented. So, am I saying that this queue idea is going to cure all these problems? No, it doesn't negate the sweat equity I just pointed out. But the queue is something that we can leverage and certainly help reduce some of these challenges. So let's keep talking. Observations from the hospital side. Here you have a very garden variety workflow where you have a medication order that's signed by a provider, sent to a pharmacist queue, where it's reviewed prior to sending it to a dispensing pharmacy. This is literally done millions of times a day across the country every day. And the reasons to perform a function like this is extremely hard to refute and is galvanized in regulatory standards and best practices across the board. And not so different than what we see during hospital discharges too. Many sites of care have pharmacy staff that's usually working their tail off to get patients their meds before those patients leave as part of the MedRec process. So why not emulate that? I think that's a really good question. So before answering that question, here's another question. Why is it so difficult to capture prescriptions if you're doing all this amazing hard work? So here's a big picture view of the outpatient prescription world, more on the technology side. And the external pharmacy network and infrastructure and an entire business model is fiercely competitive. And there's a very strong interconnection between e-prescribing, PBMs, and pharmacies. A ton of investment has gone into that. And nothing against the network and competition. I completely respect it. But it's, I would say, easy to create the rules of a system when you build it and own it. So what I'm really trying to attempt to do in this presentation is provide a good opportunity to help healthcare where healthcare is happening. And I want you to look really closely here in that health system bubble as well. And what looks like maybe a millimeter is really a lot of opportunity for integrated service. And I actually pull out health system pharmacy out of that ERX network directly because it's not uncommon that retail pharmacy integration within an EHR will not even go through SureScripts at all for internal prescriptions. Just another potential advantage for health systems with transaction fees and further script routing and manipulation. But regardless, the queue itself, which I'm proposing is living right here, will prevent that prescription from ever getting to the e-prescribing network or pharmacy in any scenario. So let's jump into what we can do. So design considerations for setting up the outpatient medication verification queue. So it starts with the ordering of a prescription. I'm giving this based on my experience. It's really based on the combination of a few variables. First being the qualifying order question, prompt, button, whatever you want to call it, that we're going to put physically on that medication order. So you have that element. You also have the element of just linking the ability to do this on very specific medication records. So you might not want to have it on every single thing. You might be targeting a particular area. And then you also have the departments that you want to focus on as well. All variables that you really can work with here. Additionally, you have two possibilities in the configuration of this, and the way I define them is opt-in and opt-out. So opt-in really means that you have the ability for the providers to send the prescriptions to the verification queue based on available services. That's really this button I'm telling you is they have the option to select it. And you can target it by medications and departments like we talked about, all medications, some, etc. Then you have opt-out, which is the situation where you're actually defaulting the selected outpatient prescriptions to always go to the verification queue unless they unselect it. So those are your options in design there. You can have either or both. So that's the ordering phase of it. Then you have the verification phase. Again, just my experience, security. You have to consider who's working these queues. So some of these services are not clinical in nature at all. So you are likely looking at opening non-traditional access to verification queues for non-pharmacists. I can say based on the experience on the software I use, there is little that can be actually modified in these orders besides conveniently changing the dispensing pharmacy. Also, you have the verification filters themselves. So you have the same old verification queue that you're used to on the inpatient side, just some new filters that can be department-based, or you have other rules-based considerations and options as well. Overall, for those excited by this idea, I will put a disclaimer out there. It's pretty high-risk setup, so be very careful about this, for sure. Really good advice. So here's just what the intervention will look like in graphical form. I think that'll help the audience out a lot. So you have a outpatient order here. This is a prescription. I made up a drug for this. It has a standard SIG. But what I'm suggesting here is you put these couple buttons here based on the different services that you might want to consider. In this case, I'm putting RX benefits inquiry or an RX consult that might be more clinical in nature. We talked about you can have that defaulted or not, available for everything or some drugs. Just tons of configuration options. Choose your adventure. And then you have the outpatient verification queue piece of this. So in one scenario here, I might have clicked the button for a benefit inquiry and this would go straight to the verification queue. Again, that would be before ever going to a pharmacy. That might be another opportunity here that we'll talk about. Again, if I had select a different option like the clinical consult, it might have gone to the queue as well, but seen in a different filter. Maybe you have a whole different personnel managing that particular queue. Or nothing gets sent to a queue at all and just goes to the dispensing pharmacy like probably typically does today. Possible use cases. Well, I can probably sit on here all day coming up with ideas, but reasons to send something to a queue. We talked about benefits inquiry. You have consult services, could be clinical, could be cost savings, could be patient education, could be a lot of things. High risk therapy, meds that are, there's a risk for admission, there's a risk for readmission, medication adherence and compliance packaging, the need for additional supplies. You can do this for long-term meds only. You can do them for only acute meds, all meds. Probably endless considerations. Overall benefits of the verification queue. First, it's completely independent of the initial pharmacy selection. So by using this queue, the health system pharmacy will always get a first pass opportunity to review the script based on the rules configured regardless of what pharmacy was picked from the get-go. Another benefit is It makes providers' job easier, or should make providers' job easier, especially when you have a medication therapy that's loaded with additional benefit review or monitoring, education, whatever it might be. You now have a nice way of delegating some of that hard work. It is now effectively part of the order. Reduces barriers for prescription capture, or it at least provides a second chance to prove service in action. So don't drop the ball. Safer than sending a prescription to a pharmacy with a note like, just checking what the copay is. Thank you. That kind of speaks to itself. No one appreciates that type of use of a prescription by any means. This also has a benefit, promotes and integrates pharmacy service. Nothing helps integrate pharmacy service more than hard coding it into the medication use process. And then you have leveraging centralization. You know, the queue really should be widely accessible to who we want working in it, whether it is outpatient pharmacy staff or even inpatient pharmacy staff, other support caregivers. Just lots of options to load balance and use resources effectively. Those are some clear benefits. So you're capturing prescriptions in a queue. Now what? And that's a very good question because, you know, there's two very important variables in this. That's first, the thing I get most worried about with a design like this is you need staff that are dedicated to managing the queues. And then you need communication methods. Those are important variables. But to answer this question really ultimately depends on what are you capturing and why at the end of the day. I think specialty pharmacy prescriptions are a great use case for a queue like this. So they require in-depth insurance investigation and coordination between providers and patients. You know, you can use prior auth teams and or other support staff, either centrally and or on site, to navigate patients through the process. And the nice thing, unfortunately, about specialty prescriptions is that they are complicated and need time and usually some amount of back and forth. But really, no matter what your use case is, what's important is setting expectations up front with the patient. That's what's really important. And perhaps this is just a great opportunity for clinical decision support even to help prompt staff to clarify that point to the patients at the point of prescribing. And maybe even printing details of this on after visit summaries. Just examples or suggestions. And as far as communication goes, you know, every one of these have pros and cons. You know, you have telephonic, you know, not always easy, but is a method. You have patient portals, certainly slick and convenient. You have messaging and firing up e-visits with patients, all reasonable options. Nothing really better than on-site communication, so in person or virtually. Again, all viable methods given different use cases. I will say, I don't know, but usually when staff say schedule a follow-up or a surgery or other service as you're leaving your appointment, they usually tell the patient to have that conversation before leaving the clinic with that front-end staff, or follow up in different ways. They don't usually say, hope you decide to come back to us for a future visit and have a nice day. They usually just don't do that. They help kind of guide the patient to that next part of their transition of care within the health system. So instead, maybe as the patient leaves, they're told to have a prescription consult before walking out. That's a question. Maybe they can get a full adjudication and price details and fix any problems quickly before ever walking out. And discussing and proving those awesome benefits and services of using an internal pharmacy network. All the stuff and more than what I would say real-time prescription benefit queries can really do. I feel like that's the power of the outpatient medication order verification queue. It's really that it supports the ability to provide service before they completely fly out of the health system's four walls. I think that is the key takeaway to the queue. Key benefit. Have an opportunity. So I think it's easy access for these queues to be used for specialty prescriptions, but I really hope that this type of technology can be used to really optimize and be expanded beyond that. Really to mitigate safety issues through transitions of care and make providers' job easier. That's what I really want to hear pharmacy is doing and performing at this very critical part of the care. It's not really taken advantage of yet. So I say it's all about capture, and how can we capture that wasted time away from providers? How can we capture patients away from readmissions? Capture those near misses. I think that is, in essence, the true value that we can get out of this. And lastly, one other last important piece of news, if you're already not aware, but I'm pretty familiar with some of the new PBMs coming to the market and the new player really being brought into the e-prescribing network is effectively the patient. And how this works is prescriptions are routed to something that looks like a lot like a medication queue, but it's in the patient's hand. It's an app. And as they sit in the office, they're getting influenced on cost and where to fill that prescription. So just something to think about with prescription capture and what competitive advantages really look like once a prescription leaves the health system and into the wild. So there's a lot of things going out there, and it's only going to get more difficult and more challenging. So hopefully you found this information beneficial and helps you in your planning to optimize pharmacy services and script capture in the ambulatory clinic environment. So good luck, and here is my contact information. Thank you.